So my name is Lawanda Williams, and I'm the Chief Behavioral Health Officer here at Healthcare for the Homeless. And I've been with the agency a little over 13 years. I've worked as a therapist case manager. I've served as the director of our housing services program here. And for the last 3.5 years, I've been in the role of Chief Behavioral Health Officer. To be quite honest, it's the people, it's the clients and the team. I count myself extremely lucky to have what I would say is one of the best teams in Maryland. We're often working with people who are left out of other systems, and people see them as walking problems. And to come into a space where we are happy to see the people that we're serving and see it not as our duty or obligation, but like as our pleasure, is one of the things I look forward to when I come to work. I think that and the laughter, I find to be incredibly rewarding. So I can do all of the CBT that I want, all of the DBT I want, the ACT that I want, all of these, fancy interventions that we do. But if it's not underpinned by an authentic relationship that's based on things like unconditional positive regard and trust and humanness, if I'm not able to see the humanity in someone that's sitting across from me, nothing else that I do will be of any value or have any sort of long-term effect. As the work here is so congruent with my personal values. So I don't find that I have to be of double mind when I come to work. There's not a way that I show up that is Lawanda at home and then Lawanda at work. And it's a huge relief to be able to be in a space where you can just be free to be who you are and work and have that be respected. I think the other thing too that really cements this work for me is that we have a really strong commitment to racial equity, and that's really important to me. When we think about equity, when we think about intersectionality, those are things that we are striving to do and do better and be better at. And it's something that permeates through every level of the organization. So I think that's a big part of why it has been really my pleasure, and it's been such a joy to be here for as long as I have been.